Hi, I'm Dr. Oz. After examining you and your symptoms, one of the most important tools that doctors use in assessing your overall health is your family history. You are the product of two people, wonderful people, your parents. And while you may have inherited their wisdom and their wit and their good looks, you also inherited all of their risk factors for disease. A detailed family history gives a doctor the criteria to decide on many diagnostic tests, such as what age to get you your first mammogram or your first prostate exam. At Dr. Oz's Transformation Nation $1 Million You, this is one of our steps, and it can add years to your life. Here's the simple way that you would take your family history. Think of a relative who is suffering or has suffered from a disease or condition that has a genetic link, like heart disease, cancer, or diabetes. Then you can answer these yes or no questions. Is this a full-blooded, immediate relative? Did this relative contract the disease or die from it before age 65? Was this problem caused by a genetic problem? In other words, it wasn't caused by your lifestyle or environmental issues. Does anyone else in the family have this condition? And do you look like this relative? Now, if you answered yes to one or two of those questions, you may be at risk for inheriting this condition. So, monitor it with your doctor. If you answered yes to 3 or more of those questions, you're likely at very high risk of inheriting the disease. So keep a watchful eye on it. The good news is that you are not doomed to repeat the fate of your relatives. There's lots you can do, even about the most serious diseases. For instance, if you have a family history of diabetes, you want to watch your waist. The weight around your middle puts you at great risk, so burn up that belly fat and reduce your chances of diabetes. When there is a heart disease history in the family, you have to be careful. But did you know that just flossing your teeth, can reduce your chances of having a heart attack? Research suggests there's a strong link between gum disease, a leading cause of inflammation, and the risk of heart disease and stroke. In fact, some studies have shown that patients with advanced gum disease have up to 10 times the risk of having a heart attack compared to those with healthy gums. We've got a detailed form when you join the program that helps you compile your whole family history. Then we've got tips for prevention for some of the health conditions that may run in your family. Physicians have been taking your family's history into consideration for years. Now it's time that you did.